alafu leta uzembe. Chani mchezo nyinyi. Kama mtanikasirikia shauri yenu bust. But I'll tell you the truth.
Right, now joining me for this discussion about testing as we speculate why Kenyans are uncomfortable with this particular test is Dr. Samran Shah, and we'll be having other guests joining the conversation later on. But I'll pose this question to you, Dr. Samrat. Why do you think Kenyans are shunning the mass testing of coronavirus?
See, there are many factors for this. I would say one, the scary part is getting admitted in Bagati Hospital or getting admitted in Kenyatta Hospital for that matter, when you already have serious patients there. So that is one thing which is scaring. Second part of getting tested is, facing quarantine facility for the entire family. And you may have to pay for it.
For sure.
Most of the people cannot afford right now to pay for quarantine facilities. I think they are the two bigger reasons why people are not going in for testing. Apart from that, I think the bigger scary picture is nobody wants to get tested thinking that I don't know, I may die because of this. So why get admitted and then die? Let's be at home and try to avoid these things.
Absolutely. But then when you look at the test itself, and I like using this analogy, someone actually said it looks like someone is trying to tickle your brain through your nose. It looks very uncomfortable. Could you explain the mechanics of that test physically?
Yeah, you see, it's actually uncomfortable because we go from the nasal pharynx into the posterior pharynx to take the swab. But I think that's the need for the day right now, because what is more important is to get mass testing done so that we avoid having a mass casualties. It is definitely going to be uncomfortable, but it hardly pains you for say 2 seconds or like, or it's not even that painful like we take the blood samples for that matter. So I think we should go for testing and not think about that 2 seconds of pain rather than think about the rest of your life.
But then while we're talking about those the physical attributes of that, or rather characteristics of that test, when you look at the normal tests that we take in hospitals, it involves maybe at most a saliva swab or maybe blood sample or urine sample. Why is the coronavirus test that invasive? Why dig that deep into your cavity?
Yeah, you see, now there are two aspects of this. We can even do a blood test for coronavirus, but these things are in trial. I think Indian ICMR board has already approved to go ahead with the blood test for that, which is called as a rapid diagnostic test. But if you want to go for a PCR analysis and have an accurate data about positivity or negativity, we are talking here about sensitivity and specificity of the test. When we talk about that, the highest number of virus deposition is seen in the posterior pharynx. That's the place where the virus goes and accommodates and starts multiplying itself. So that's the reason why we choose that place as an area wherein we go put that swab, so that we get a good number of positivity and we don't get a false negative test for that matter.
Absolutely. And while we're talking about the false negatives and those people who are not exhibiting symptoms, we have been told there's quite a number of people who are walking around amongst us who seem fine. They don't seem like they have them, and they might be the ones actually spreading this in certain communities. They might not, might not be actually out of malice. They just feel like they're okay. So what is it? Is that why we have to dig that deep into trying to find tests? Is it that they have a low level of the viral count? What happens in these people?
See, when we are doing the test, we are talking about PCR analysis. When we talk about PCR analysis, we are going to take a small piece of sample from your swab and then going to multiply the same thing in the lab and then analyze it. It's not like when you take the swab, you put it in the microscope and see it. These are viruses which cannot be seen on a microscope. That's the reason why we have to take a swab from the area where we can get those viruses, go to lab, multiply that into 1,000,000 times. That is the point when you get to see that virus available. So that's the reason why posterior pharyngeal swabs are that important, especially when it is a viral infection. And you see, that's why we have a lot of false negative cases, because it's a virus. It cannot be seen on a microscope. It can't be seen by a naked eye on a microscope. So it needs to be multiplied several times in microscope by a PCR analysis test. That's why we are having false negativity also being high, and that's the reason why this spreads also very faster.
Okay, so aside from that, there's the question of the timings between the time when the sample is taken and when, you know, the results are given. There's those who speculate that you could actually get the virus after the sample was taken and you get results. So while it might you might test negative, you might actually have it because it has not perhaps manifested in a way, or you might not have gotten in contact with that person. How is the efficacy of testing right now?
Yeah, that's very true. It can happen because we can see that now even asymptomatic patients are being tested positive. Yeah, so that's the reason why we are talking more and more about mass testing, because if you get tested today, it may happen that you are negative today and you may turn out positive in a later point of time.
Yes.
That's why what is important right now is to go for mass testing and those who are positive, find out their contacts and quarantine them.
Yeah.
So when you quarantine them for 14 days, that's the maximum time period when you can get symptoms. So you can keep a watch on those 14 days and then test them if required again.
Yeah.
So that's why we are talking about mass testing and quarantine facilities.
And joining the conversation is Alan Maleche from Kellen. Alan, you have heard about the possibility of enforcing testing by force, so that because people seem to be scampering, they do not want this to do this, you know, voluntarily, even though it is quite necessary, particularly in the pockets where pockets of our community that have been flagged as flashpoints. How do we strike a balance between the need for testing and the enforcement of testing? This is, I think, something that is unheard of. I've not heard anywhere where it's actually being enforced.
Thank you for having me on the show this morning and pose indeed an important question about where do you strike the balance between getting people to test and addressing the fears and concerns that they have. And I think for me, the balance definitely lays in providing information, explaining the importance of why it's good to take a test, but the use of force, use of threats would be a futile exercise, because we have learned from our experience of more than 30 years of having HIV, that indeed when you use force, when you threaten people, you will get people avoid coming forward for a test. And unless you address the issue of fear, unless you address the issue of stigma, you will not then be able to get people to voluntarily come out of tests. And unfortunately, some of the things both the national government and county governments have done have driven that fear and stigma. For instance, making people pay for quarantine, jailing people in quarantine, and also those who are COVID positive actually being held in hospitals, as has been the case in the Kenyatta University Hospital, for lack of payment of medical bills. And some of these are the things that plays in someone's mind to say, if I test and I'm positive, how am I going to deal with all these things? I probably rather sit at home and not have to face those challenges. So we have to find a way to strike the balance of providing accurate information in a way people can understand and making them understand why this test is important. But forcing someone to test goes against the laws in this country relating to the right to health.
Now, if you're going to draw up a sort of plan on how you'd go about this, how would you approach it yourself, practically speaking, and knowing how our communities are? How would you approach this sort of sensitization, if I can call it that, so that would dissuade people against running away from the test?
I think one of the ways to go about it is drawing from community health volunteers who have worked in the field of HIV/TB in terms of helping spreading messages. Many of the messages are coming straight from Afia House, but people in the community relate more to someone who's closer to them. If I have a community volunteer, if I have a neighbor who's a healthcare worker who tells me I've done the test, this is the importance of doing it. That is one strategy we have to be able to adopt. The government indeed has funding. It can tap into community health volunteers who can be able to communicate at the level others would be able to understand in the hotspot areas that they're talking about. That definitely would be the first. But the second step would be to address all the fears that have been raised so far. One, that quarantine, I will not have to pay if I have to go to quarantine. Secondly, that the quality and the hygiene standards in quarantine are not deplorable or inhuman. Thirdly, that if I turn positive, that the government will be able to support my treatment at no cost on my part as a Kenyan citizen, because they have an obligation to be able to do so. So those fears have to be allayed. And for those fears have to be allayed, the government must actually do what it's supposed to do in terms of ensuring quarantine facilities are safe and quarantine facilities are of a quality that would help people, and that if you get positive, you get tested. And we are not talking about only community people, but this is also a challenge that healthcare workers are facing. The government a few weeks ago said they will start mass target testing for healthcare workers, but we've not seen an indication of how many have taken, how many haven't taken, because there are also healthcare workers who have the same fears. Will I be quarantined? Will I be taken to isolation? Who's going to bear the cost? So this is not only something for the people in the community, it is something that's affecting all players in this particular COVID fight.
Yeah, and I love that you brought up that note. Dr. Samrat, could you tell us about the sensitivity of healthcare workers, why they need this sort of testing, and how that is actually trickling down, perhaps infections could be trickling down from health workers into their communities or families?
Yeah, in fact, it's very important point to be raised, because healthcare workers are the people who are front lines for treating COVID-19.
Yes.
Especially those people who are working in hospitals. Healthcare professionals, by that I mean not only just the doctors, I mean the doctors, the nursing staff, the front desk people, all of them who are working in hospital facility should undergo mass testing, because we are not seeing symptoms of patients. We are seeing patients coming without any symptoms. We are seeing patients coming with fever. We are seeing patients coming with vague symptoms like loss of smell, loss of taste. So that's very important that we test healthcare facility people, so that we don't infect as a healthcare fraternity. We don't start giving infection to patients. That's very important, that we are tested first as a healthcare professionals. All of them should be done a mass testing, so that all those who are positive are isolated, and only those who are negative are taking care of patients.
Wouldn't it be more practical to just have healthcare workers, perhaps those who are working at the facility in Bagathi, just having their own areas where they work during this time, instead of going back home? And some of them use public means of transport, some of them interact with their kids. Would it be just safer to have them have their own quarters where they spend their time there until we win this fight against COVID?
In fact, across the globe, all the countries are doing just the same. You see, all those people who are healthcare professionals who are working for COVID-19 battle are being taken from the government facility or from that private hospital to a government quarters, or say hotels for that matter. Most of the countries have started booking hotels. The entire buildings have been taken up, so that these doctors, nurses and the paramedic staff are being taken care there, so that they don't go home, they don't use public transport, they don't infect others for that matter.
Absolutely.
That's much required, because all these healthcare professionals are prone to develop these infections more than anybody else for that matter.
And it's quite scary, the fact that some actually don't even present the symptoms. So it would take time before you actually know how far this person would have spread it if they hadn't been tested, right?
True.
Now, when you look at some of the neighborhood that have been highlighted, I'll throw this one to Mr. Maleche. Why is it that certain communities are not as keen as others to follow the rules? For example, when you look at page 6 of the Standard, pictured here, we are having a bunch of men just hanging out really closely. Some of them are not wearing their masks. They seem oblivious to the dangers of this. Mr. Maleche, if you can hear me, what would be the characteristics about these neighborhoods that would make them more prone to infections as opposed to others?
To people's personal behavior and level of appreciation of the seriousness of the coronavirus, to their health and to the public health system. I think it goes back, and I know I sound like a broken record, it goes back to the whole issue of how do you communicate these messages? Is it only by Twitter? Is it only by TV ads? Is it only by press briefings? What is the way you can communicate information to these people in a way that it would make sense to them to understand why, one, mass testing is good, but secondly, why you need to adhere to the basics of washing your hands, maintaining physical distance, your cough etiquette. So for me, it's all about behavioral change. I think it's not unique.
Right.
If you compare this, and it's not good to make comparisons, if you look at the issue of HIV,
yes.
we all know that the theory was that if you have multiple partners and have unprotected sex, you put yourself at a risk of getting HIV. That was the messaging, but still some of those acts happen because human beings have got different DNAs and they're wired differently on how they receive information. So indeed, not everyone will obey. You'll have people that will need either more coercion, more information to be able to adhere to the rules and know why it's important. And so we need to try and figure out innovatively, whether it's through the government, whether it's through civil society, whether it's through technical partners, what is the specific way you communicate to certain groups and communities in a way that they'll understand? Is it by them seeing their leader take a test? Is it by them seeing their leader wash their hands? Is it by them seeing a close relative? What works for that particular community in terms of information that will help them take a positive health behavior approach that would save their lives?
Yeah, that makes a lot of sense because different communities do have different characteristics and would respond to different ways of enforcement or communication. Now, Dr. Samrat, when we talk about testing, there are certain examples globally. I'd love to make the example of China that have, not China, but Germany, that actually went for mass testing, while other European countries went for testing based on symptoms that were presenting, and therefore they were able to avoid the number of deaths that were experienced in the neighboring or in the region in general. So what would you say, how would you explain how this works to the point that it would reduce the number of deaths among communities?
You see, we need to understand first two things. Over a period of 4 months, we have got to know two things. That one, there is a way by we go ahead with social distancing and try to cut down the curve. The other way is to go for mass testing and quarantining all those contacts who are coming in contact with the patients. So some countries adopted policy of going for social distancing. Some countries adopted the other policy of mass testing. So when we talk about social distancing policy, it means we go for social distancing and we go for testing of those people who are symptomatic and who have highly positive history. So when we look at these figures, let's talk about China and compare this with Italy, or talk about Germany and compare with Italy. Germany and China adopted a policy of going in for mass testing and contact tracing, whereas Italy adopted, and most of the African countries are adopting and going in for social distancing policy. So when we talk about these things, no matter for that matter, UK also adopted to go for social distancing and testing those people who are symptomatic. So when we compare these things, it was found that the death rate was comparatively less in that countries who went for a policy of mass testing and contact tracing compared to that of death rate in those countries who went for social distancing. So if we compare Germany and Italy to neighboring countries, we can see that the Germany's curve cut down very quickly and the number of deaths seen in Germany was very less compared to that of Italy because of mass testing being done in Germany. One good example for that matter is Malta, a small country in Europe which underwent 82,000 testing per million population and the death rate was only 8, and the curve cut down.
Imagine that.
And compared to that, Kenya, we are having testing facility of 481 per million population. So which is going to affect us on a long-term basis? It's going to affect in two ways. One, the disease is going to prolong for a longer duration of time. Two, you cannot take out the lockdown because social distancing policy was followed and not the mass testing policy. So if you go for mass testing policy, even lockdown can be withdrawn very soon. But if you go for social distancing policy, the lockdown will take time.
Yeah, but then brings the question of capacity. Where are we as far as capacity is concerned?
Definitely, we are in a compromised state in terms of capacity. We have very less testing capacity, as we can see. In fact, Jack Ma's assistance which came, it was a big help for us. but we need to find out ways to go for mass testing, because that is the need of an hour. Let's think about the long-term aspects of this and not the short-term aspects of it. If we don't do this right now, we are going to have a disaster in the country, which can be avoided by just going for mass testing and going for contact tracing.
Absolutely. And we're going to dig into the testing kits. You could, and I'd love for the doctor to actually explain to us what the testing is like and how it works, and obviously the controversy of some testing kits not being as efficient as we would like them to be. Let's take a short break. When we come back, we'll have more for you right here on Morning Express.